Hi friends, welcome to another important topic in ophthalmology, bacterial conjunctivitis. Bacterial conjunctivitis is a very common cause for red eyes, and you will come across red eyes in your clinical practice. So it's very important to know what are the characteristic features of bacterial conjunctivitis, because it's relatively very easy to diagnose and very easy to treat as well. Some important features of bacterial conjunctivitis include it starts as a redness of eyes, and it generally starts in one eye, and over a period of few days it involves the other eye as well. So majority of the patients will come to you with the bilateral red eyes. Because there is no much pain and no problem with the vision, the presentation is quite late. The other important feature of bacterial conjunctivitis include discharge in the eyes or sticky eyes. The patients may say their lids are stuck together, or they find it difficult to open their eyes. Some patients may complain of discomfort in the eyes because of the discharge in the eyes. These red eyes may be present in few members of the family, or there may be history of red eyes in some other people they come in contact with, because it generally spreads very fast from one another by close contact. Three important things you must remember about bacterial conjunctivitis are: the vision is not affected in these patients, they don't complain of pain, and they don't have any photophobia or intolerance to the light. If any of these symptoms are present in a patient with red eyes, then probably the diagnosis of bacterial conjunctivitis should not be the first one. When you examine the patient, you may notice obvious discharge in their eyes, and the lid may appear swollen, that is, lid edema may be present, and the conjunctiva may show diffuse congestion. This redness of conjunctiva is more common in the fornices, that is, corners of the eye. Rest all ocular examination will be normal. The cornea will be clear, pupil will be normal, the lens will be normal, hence all ocular examination will be normal. So two important symptoms or signs that give you a clue to bacterial conjunctivitis include redness of the eye, that is conjunctival congestion, and discharge in the eye. Do we really need to investigate these patients? Well, in majority of the patients it's self-limiting and there is no need to do any investigations. However, in certain cases you may want to consider doing gram staining and culture sensitivity. Most bacterial conjunctivitis responds well to topical broad spectrum antibiotics, either in the form of drops or eye ointment for a period of about a week, and they generally resolve in 7 to 10 days time. Please remember, there is no role for any systemic antibiotics in these patients. And most important thing to remember is to wash your hands before and after you examine these patients to prevent developing conjunctivitis in yourself. When you look at this eye, you can see the lashes are stuck together and there are some yellow discharge on the lid margins. That is what is very typical of bacterial conjunctivitis, and the lid appears a bit swollen, and there is a conjunctival congestion or redness of the eye. It's also called as pink eyes. The cornea appears clear and pupil is normal. So This picture gives you a typical presentation of bacterial conjunctivitis. Hope you enjoyed this short talk on bacterial conjunctivitis.